Having said all of that, the number of publications on radiofrequency ablation in terms of pure quantity is fairly high. So it is one of the most researched approaches to pain management.
Welcome to Chronic Pain Chronicles with Dr. Karmy, where we delve into the complexities of managing chronic pain and explore the most effective treatments available today. I'm Ravina, your host, guiding you through the often overwhelming world of pain management. In today's episode, Dr. Karmy shares his knowledge on radiofrequency ablation, a treatment that is being used to target mechanical lower back pain. With back pain being the most common form of chronic pain and affecting nearly 8% of the population, finding effective long-term solutions is critical. Dr. Karmy breaks down the science behind radiofrequency ablation, examines its pros and cons, and the clear indications if this is the right treatment for you. As always, we're privileged to have Dr. Karmy with us, a veteran in the field with over 2 decades of experience, to provide his expert insights. Let's dive in.
Hi, this is Dr. Karmy, and today I'd like to talk about the pain management procedure known as radiofrequency ablation. Are you someone who has gone to a pain clinic and tried nerve blocks and cortisone injections, but neither one seemed to provide lasting relief? Or if either did help, it was only helpful for a day or two? You might also find regenerative medicine injections like platelet-rich plasma are out of your budget. So what are your other options? Traditional pain treatments focus on reducing inflammation around the nerves that lead to painful areas, desensitizing those nerves, or easing muscle spasms that might be compressing them. However, another option is radiofrequency ablation. With radiofrequency ablation, however, the goal is different. What you do with radiofrequency ablation is you simply destroy the nerves. And the idea, of course, is if no pain signals are coming from a worn out, inflamed, or painful joint, then you will not realize that you are in pain. And so hopefully you can then go on with your normal life. Radiofrequency ablation is a procedure that's offered in some but not all pain clinics. So what are the pros and cons of radiofrequency ablation? Is that worth a try? In terms of pros, this is an OHIP-covered service, so there is no charge to the patient. Second of all, if it works, it will often work for a long period, ranging anywhere from 2 months to a year on average, helping for 8 to 9 months. There's also a lot of research on radiofrequency ablation. This is an approach that came from academic institutions in the US, where several companies make equipment for radiofrequency ablation. There was both expertise and money to do a lot of studies. The results, however, are a mixed bag. Invariably, when you see reviews done by associations of physicians who perform these procedures or published in journals whose editors are financially benefiting from providing these procedures in their practice, these reviews often will state that the evidence supporting the use of radiofrequency ablation is fairly high. On the other hand, when you look at the reviews of that same evidence, but done by biostatisticians or physicians who have no vested interest in promoting the approach, the results are often classified as low-level or inconclusive. Having said all of that, the number of publications on radiofrequency ablation in terms of pure quantity is fairly high. So it is one of the most researched approaches to pain management. So what are the cons of this procedure? First of all, it is a more aggressive treatment. It's almost like a mini surgical procedure. You are destroying tissue. So if you happen to burn the wrong nerve, the complications can be catastrophic. Now, to put it in perspective, if physicians are good at what they do, the chances for these very serious complications are not that high. Another downside is that quite frequently you will experience post-injection pain that can last for weeks. It has this sort of shooting, nerve-like pain quality. There's also a concern that in addition to burning the nerves that go to the little joints in the back, called facet joints, sometimes the nerves supplying the muscles of the back or neck could be affected, potentially leading to muscle atrophy or even, in rare cases, significant neck weakness to the point that people cannot straighten out the neck. Again, I'm talking about the severe complications such as the inability to straighten out the neck as being extremely rare. Having said that, there are a lot of physicians who say you shouldn't do radiofrequency ablation on both sides of the neck for that reason. Additionally, since these procedures are usually done under X-ray guidance to make sure your catheter is in the right spot, there will be some radiation exposure. Also, over time, radiofrequency ablation becomes less effective over time. And what do I mean by that? For example, let's say after the first time you burn the nerve, you get a year's worth of response to the radiofrequency ablation in terms of pain reduction. Then after a year, the nerves grow back out and go to the joint, causing the pain to come back. So then you go back and you burn those same nerves again, but then this time the nerves grow back out after 9 months. Then you go back for the third time and burn them again. This next time around, maybe it only helps for 6 months, and the time after that, 3 months, then after that, 2 months. So often it's a law of diminishing that returns. Yes, you have to keep doing these procedures to maintain benefits, but sometimes the duration of benefit and the magnitude of benefits reduces over time. So why is that? It's because when nerves grow back out, they sometimes take a different path than the original path that they took. Sometimes they don't go as close together as before. The thing to remember about radiofrequency ablation is when we do it under X-ray guidance, we cannot actually see the nerve. We just get to know which bone the nerve passes as it goes to the facet joint to the back, where we then can position the catheter next to that bone. So if a nerve happens to take a different course when it regenerates, a physician is not able to recognize that. And then the last part is perhaps self-evident, but maybe not. So essentially the back has a lot of potential sources of pain that are sometimes called pain generators. One of these pain generators of the back are known as facet joints. Radiofrequency ablation is primarily used to treat pain coming from these facet joints. These are responsible for anywhere from 15 to 40% of back pain. Then other sources of back pain are discs, compressed nerves, ligaments, and back muscles. So radiofrequency ablation can only treat one of 6 or so possible sources of pain. And what that means is if you have somebody coming in with back pain, the chances of them having pain coming exclusively from facet joints are not very high. I would make a very rough estimate that if you take an average patient with back pain and try radiofrequency ablation on that patient, about 10% of the patients will have a good response and the rest won't respond. There is a way to stratify these patients, and often physicians will do median branch blocks before proceeding to the ablation procedures. And depending on the results of those blocks, where they just freeze the nerve rather than destroy it, they decide whether or not to proceed to radiofrequency ablation. It used to be that you would need to have a reduction in pain by about 80%. before you could proceed to radiofrequency ablation. Now that number seems to be drifting down, where a lot of physicians will say that you need only a 50% pain reduction to proceed to radiofrequency ablation. But now think about what it means if you only have a 50% reduction in pain after the median branch block. Essentially, at the most, 50% of the pain that person is experiencing is caused by the facet joints. That means that the response at best will only be partial. Also, even when you stratify patients that way by doing a preliminary median branch block, sometimes they do just one and sometimes they do two different ones with an anesthetic that has a different duration of benefit. But even if you take that select group, only about 60% of them respond to radiofrequency ablation. Although it is primarily used to treat mechanical back pain, it does have other applications in chronic pain. It can be used to treat neck pain, less frequently knee pain, and sometimes even more rarely, pain in the shoulders. Also, there's another flavor of radiofrequency ablation called pulsed radiofrequency, where instead of destroying the nerve, they just irritate it by increasing the temperature but not burning it completely. This approach is helpful for treating pain from mixed nerves that are both sensory and motor. So if you were to completely destroy it, you might paralyze an area. There is this idea that if you just irritate the nerve, you may have some sort of reduction in pain. There's a lot less research on pulsed radiofrequency as opposed to radiofrequency ablation. It does seem to look like that. The pulsed radiofrequency ablation duration of response is not as long as with fully blown radiofrequency ablation, but on the plus side, perhaps the risks and side effects are lower. Also, one other wrinkle to the story is that there's also cooled radiofrequency ablation versus regular radiofrequency ablation. In both cases, the nerves are being burned, but cooled radiofrequency ablation uses a different method where the size of the burns are greater, which is sometimes advantageous when one is trying to destroy many nerves, going to a bigger joint like the sacroiliac joint. What are my other thoughts on radiofrequency ablation? Well, my other thoughts don't have to do much directly with the procedure itself, but have to do more with politics, even though radiofrequency ablation only helps a small percentage of patients with chronic mechanical back pain. A lot of physicians who practice radiofrequency ablation try to make it sound like it's the only treatment that should be offered to patients because it has the most research to back it up compared to other approaches. So frequently they badmouth other approaches such as nerve blocks and cortisone injections. They are trying to create an impression in the heads of politicians and the Ministry of Health that radiofrequency ablation should essentially be the only procedure that is covered for mechanical back pain. And if they succeed, I think the field would be worse for it. A lot of patients with chronic pain will not be able to access treatments that they find helpful. My final thoughts on this treatment as a whole are this. If you are someone who tried nerve blocks and cortisone injections, especially if you cannot afford some of the regenerative medicine procedures like platelet-rich plasma injections and prolotherapy that are perhaps safer, then I think radiofrequency ablation is worth a try. It's fully covered by the government, and if it works, it can help for a long time. The vast majority of patients who use it don't get the side effects. Yeah, it's worth it. Thank you.
Thank you for listening to the 7th episode of Chronic Pain Chronicles with Dr. Karmy, where we explore chronic pain from a physician's point of view. In our upcoming episodes, we'll continue to delve into some of the most effective and widely used approaches to managing chronic pain. We'll also investigate the causes of chronic pain and where the field is heading in the future. I'm Ravina Ojala. Until next time, take care. Disclaimer: when it comes to your health, always consult with your own physician or healthcare provider for personalized advice and guidance. The information provided in this podcast is for educational and informational purposes only and should not be considered medical advice or a substitute for professional medical care.